Hello and welcome. You're watching McLaren Port Huron's Today's Health. I'm your host, Barb Winters. On our program today, we're going to be talking about common causes for shoulder pain and what you can do about them. And joining us for this discussion is orthopedic surgeon Todd Murphy. Dr. Murphy, welcome back to the program.
Thanks for having me, Barb.
Well, I know the shoulder is really complex, so can you take a little while to explain the anatomy to us?
Sure, be happy to. So this is a simple picture of the shoulder. So the deltoid muscle, the big muscle on the outside, has been taken off on this picture here. And what we're looking at underneath here is the rotator cuff where it attaches. You have a tendon up in the front here. There's a couple on top that come down, and you can see where those attach there. One of our bicep tendons, we have two tendons to the bicep. One comes up in the shoulder here and attaches inside the shoulder joint itself. The other tendon to the biceps attaches outside the shoulder here. And then we have the acromioclavicular joint, so that's the clavicle or our collarbone, and that's where it meets our shoulder blade. And you can see we have ligaments that keep everything in place through there. And then the main joint, the main shoulder joint, is underneath this tendon here.
That just tells me there's a lot of things that can happen to your shoulder.
That's true.
What are common causes of shoulder injury?
Probably the most common cause is overuse or an inflammatory type injury where somebody picks up a new workout program, or in the spring, a lot of yard work, lifting leaves, things of that nature. Trauma would be second, where patients fall, slip and fall, or a heavy object falls off of a shelf and they catch it, unexpected type things. Sports injuries also, that and trauma would kind of coexist with each other.
Now, is arthritis common in the shoulder?
It's not as common as it is in other joints, but it's not uncommon.
And what would the symptoms be then if you had arthritis in your shoulder?
Pain and stiffness, generally. So, and then patients will say that they're losing motion in their shoulder. Night pain is a common one. They have trouble sleeping, and a ratchety feeling, like they feel something grinding.
Okay, so then how do you make that diagnosis?
Physical exam and then x-ray, simple x-ray such as this one.
And tell me what this x-ray shows.
This is the shoulder joint on x-ray. So here's the collarbone, as just like we went over on the model, and then this is the main shoulder joint here. And this patient has advanced arthritis. You can see the bone spurring starting to form, and there's just complete loss of the joint space there.
So what are the treatment options then?
Well, first-time patient, if they come in and it's not too bad and it just seems to be a little bit of an insidious onset and they're just wondering what's going on, anti-inflammatory medications. And then we talk about activity modification, some simple stretching to keep their motion, because the motion, they will start to lose a little bit of motion as it becomes arthritic. If they're having trouble with night pain, things like that, first line of treatment might be a cortisone injection to help with their symptoms.
But you can't stay on anti-inflammatories forever.
No, usually short bursts. So I always tell patients they have good days and bad days when they have arthritic conditions, whether it's the knee, the shoulder, the hip, and they know what better than I do, what they're going to pay for. So if they're doing things with their family or if they're out on an outing, I try to have them preventatively take some anti-inflammatory before, during, and then after those activities, just to kind of keep things at bay.
Is surgery ever an option for patients with arthritis in the shoulder?
If they fail all of those things and it's starting to affect their life and it's becoming a big issue, or they're not getting any sleep, or they're coming home and just in a bad mood because the shoulder's giving them so much trouble, then we start to talk about surgical options.
And what are they?
For a patient with an intact rotator cuff tear, a standard shoulder replacement would be the option. And so this is an example of that, where you can see the ball has been replaced. There's a stem that goes down into the bone there, and then you can see here where the socket's been replaced as well. So there's a plastic insert on the socket there, so instead of bone rubbing on bone, we have metal rubbing on plastic. And so
what's the recovery time for
patients? Generally, about 75%, 80% of my patients will go home the next morning. They go home in a sling. I keep them in a sling for the first 6 weeks because there is one tendon that we have to go through to get into the shoulder, and that tendon is very pivotal that heals properly. And then just some gentle range of motion type exercises. Most patients will notice the difference in their night pain fairly quickly. Within the first week or two, they'll say, I'm sleeping much better because that pain's gone. Stiffness, it takes a while to work the stiffness out, and like I said, it's important that that tendon heals, so it's a very strict regimen for the first 6 to 8 weeks.
What kind of mobility do you have afterwards, and strength in your shoulder?
Strength is good. Mobility, I always tell patients 130 degrees, 140 degrees is average afterwards as far as raising it up. That would be to about this level here. Occasionally you get patients that get all the way up over their head again, but most patients are pretty stiff. They've lost a lot of motion before surgery, so it's improved from what it was before the operation. They have full mobility from shoulder level down and at waist level, and oftentimes much better than it was before surgery because it was so stiff before they had the operation.
Now, is this a surgery that after you're out of the sling and things like that, then you have to do physical therapy?
Oftentimes we do some physical therapy. It's very gentle, just some stretching to help, and a lot of it can be very self-explanatory where it's not as intense as maybe some of the physical therapy that we do for athletes to get them back to sports. So we tend to go with more of a gentle route, have them get their motion back, and just let them use the shoulder.
All right, well, we're going to move on to rotator cuff tear, but first we're going to pause for this message.